Hi, it's Melanie White here with the Sage Women podcast, and I'm really looking forward to talking to Michelle Hasani today. Michelle, welcome and thanks for being here.
Thanks, Mel. It's lovely to be here.
I would love it if you could introduce yourself to the listeners, please.
So I'm a wellbeing co-design specialist and coach, and I work with all levels of organisations to co-design wellbeing strategies, policies, initiatives, and to create thriving workplace cultures. I'm basically driven by a desire to inspire organisations and individuals to embrace change and create environments where wellbeing and leadership are pivotal to their success.
And it's so true, isn't it? A lot of people think that work and wellbeing are separate, but they actually are interdependent.
Yeah, absolutely. So, and I guess the other bit is my focus is more around midlife. So really working with people who are at that pivotal point in their careers where transition is
thrust upon us.
Yeah. Well, life's one big transition.
Yeah.
It's the transitions through that midlife period are more significant than potentially some of the others and often less talked about.
It's a good point. And given that they're not talked about and it is a really important time, that's what we're here to talk about today, is the true cost of menopause. And that's to individuals and to businesses, right?
Yeah, absolutely.
So I've seen some figures, Michelle, and I know you've seen these as well, that the cost of menopause to organisations is in the order of $10 billion per year. And that's recent research out of Griffith University. And then we're also seeing from the Australian Institute of Superannuation Trustees costing individuals $17 billion a year in lost super and wages. Huge costs. And it makes me say, well, no wonder we're seeing an increase in women's homelessness. And we're seeing a huge issue, which is women not speaking up, struggling with symptoms, brain fog, cognitive function, questioning who they are and what they want to do for the rest of their life, and leaving the workforce early. And we're seeing a too high proportion of women in that situation. So can you tell us a little bit about what the areas are that are impacted for a woman business?
Yeah, I think I guess I categorize it into 4 different areas. So the first being that the impact to career for the individual. And the spin-off on that is the impact it has on the workforce and all of those costs that you've just said. The second is around the financial planning and healthcare impact for an individual. And then the social impact, so how it impacts our relationship and our communities and our environment, our families. And then that personal impact, so relating to quality of life and the ongoing needs that a person navigates to basically find themselves well and reconnect with themselves through such a huge hurdle,
Yeah, it is a bit of a shock when so many things change physically, emotionally, mentally, and it's outside of your control, let alone everything else that's going on in your life.
Yeah, and I think the fact that we don't really have open conversation about menopause and the fact that it is such a natural part of our life, our life trajectory. And so because we're not talking about it as openly as we could, it's really impacting, all of those 4 areas. But for an organisation or a business, what we then see is that inability to keep good women in the workforce is pivotal, particularly if we want strong gender equity within our boards and our leadership and those decision-making. And it's at the prime of a person's life where they've basically often become empty nesters, and they basically have the capacity to really link into their purpose and passion, but then their health takes a bit of it, we all navigate it differently, but it impacts a person's health and well-being. And so then they're not able to necessarily give their all when it's actually at the time when we'd hope that they could, and when businesses really need them to stick around.
Yeah, the loss of wisdom and IP, guidance, leadership, mentorship, client relationships that have been built over many years. There's so many amazing qualities that a mature woman brings to an organisation. And maybe I'm starting down the road of what I want to ask you about is, what are those non-financial costs to businesses?
Yeah,
where does it really hurt them?
Well, ultimately it hurts it in their back pocket, like in terms of their if you think about losing all of that wisdom, the IP, all of those things you've just said, where it hits is the cost of recruiting and training people to be able to step into those roles is huge, but I think it's more than that. I think it's about when people leave and they're not feeling at their best. People are leaving businesses feeling unsupported because there isn't an option to do it differently. Whereas if you've had a great relationship with an organisation or a business that you've worked with over a period of time, and you're able to have those open and frank conversations about what your needs are, that's when flexibility and adaptability and the reviewing of what an organisation currently is doing can actually keep people well and at work and create those environments where people feel safe. So I think it comes down to your talent retention. Is one key. The other cost is about that brand. So really being able to, have the brand that an organisation is portraying, and then how they're treating their employees, or how they're really fostering that
alignment.
Is there. So they're two key areas. But then the other is also around, that loss of productivity, the loss of ability for people to perform at their best, when often women don't really understand what's going on in themselves. And often that perimenopausal phase can be a time when people are still trying to work out what's going on. And then by the time it catches up, it's like, oh, that's what's been happening. So that's why I'm not performing at my best. And I think because systems don't necessarily support people who are going through perimenopause and menopause, often it's too late when people recognise it. And so you've lost the talent, you've lost the productivity, whereas some slight tweaks in how things are done can actually keep people in the mix.
Because Gen X, we are a very loyal generation. We're determined. We have that keep quiet and soldier on mentality. And that means that we push ourselves to keep doing the standard of work and the performance that we've always done. And yet we burn out and then we give up. So it's this hidden burnout cycle almost.
Yeah. And but then
without that conversation, what happens? Yeah.
And I think too, Mel, people think that they're burning out when in actual fact, the symptoms between burnout and menopause are very similar.
Yeah.
So it's not necessarily a true diagnosis of what's going on. So the symptoms might appear to be the same, but the cause of it is quite different, or can be quite different. And so that's where that transparency of conversation and people feeling safe to talk about what's going on can help people to really navigate menopause and perimenopause better.
I'm thinking also, as we're talking about the ripple effect of a resignation, somebody who's looked up to and revered in a company, and sometimes there are those flow-on resignations too, or clients jump ship to follow that person or whatever it might be.
It really depends on the type of business that you're in. But yeah, I mean, I think they're all relationship management is a huge one. If you've got a great relationship with one person and they leave, often it's like with coaching, people buy your service because they have the relationship connection with you. In other industries, it's exactly the same, where that connection and that relationship is pivotal to the service that they're getting or the products that they're purchasing, that kind of stuff. So I think they're all the things that we often don't actually put a price on, but they are huge, and can really impact the financial well-being of the business, let alone the individual in the process.
Yeah, I believe there's going to be some research into these uncosted areas, but I'm a bit scared about seeing the figures actually. And then I guess to the other point that you raised earlier, what's the cost to individuals? What are some of the things that they're facing at this time?
Well, I mean, this is how long's a piece of string, and I think it's about to the individual, to start with, cost of living is on the increase. And so having a disruption in career and that financial earning capacity can really impact. So we are seeing higher numbers of women in midlife experiencing homelessness.
Yeah.
And again, that number's quite hidden because women are incredibly resourceful. And so we don't truly know the actual cost of what that is to our society or to the individuals at this point in time. So that's the other thing. The second is around our systems in terms of superannuation are all geared very much to, they were created around men, and not around women who press pause on their careers multiple times for child rearing, family support, raising children. And then you put menopause in the mix and there's potentially another pause. So our super system doesn't necessarily fully support women anyway. And then an interruption in career at that midlife, where often people have the capacity because they don't have as much debt to be able to pouring into that, is very much impacted. Then you've got the cost of relationships. So if you've, women going through perimenopause and menopause, often those things like poor sleep, mood changes, not feeling confident in yourself because you're not quite sure what's going on. You're seeing its impact your purpose and meaning because you might be changing your role or working less, not feeling productive. That has such a spin-on effect to self-esteem, to then how you might interact with your relationship with your spouse, your children, your community. So the ripple effect of that, putting a dollar amount on that, I don't think anyone's really done it, but I think it's huge. And then if someone is, when you look at the divorce rates, they're increasing for older couples, and potentially that can lead to huge reduction in financial security and safety. And, the spin-off on that then raises a whole heap of other concerns for a person, impacting mental health and well-being, the quality of life for a person, and then their ability to actually navigate what they need and where to get it.
And I think I'm thinking of another thing that we know as coaches is that people that come to us for support to improve healthy habits, it's often that they're so stressed, so tired, so emotionally overwrought, so overwhelmed that they stop eating well, they start reaching for convenience foods or alcohol or stop exercising. So that flow-on effect into personal care and health habits is really significant too, which then leads on to, gosh, it's a bit depressing, all this, isn't it?
That's right. But I think all of those foundational things, so, having great exercise routine and being able to eat nourishing foods that fuel your mind and your body, being able to sleep well, all of those have that positive spin-on effect back to people's careers and how their mind works and how they're able to be productive, and, helping people to really connect with and build their mental fitness and agility is really important in all of this. And so, I mean, really, we need to be starting this way before perimenopause.
Yeah.
But if those things are consistent, then it helps people to be more able to navigate perimenopause and menopause in a smoother transition than what, and then, adding to the mix, and often it's not so much talked about, is those people that are put into early menopause as a result of cancer treatment or other medical conditions that impact. And I think that there's a whole other lot of costs that we haven't even touched on.
Yeah. So on the upside of things, or the opportunity side of things, what are maybe 2 or 3 things that a business could do to help women to stay safe and well and at work?
Yeah, I think the first is to not see the subject as taboo. I think there's a whole heap of work that could happen around the language of leadership and menopause, and not seeing it as just a women's issue. This is actually a problem that affects everyone because of the spin-off of what you lose as a business if you don't support women to stay well and safe at work. So opening that conversation, really looking at, is the workforce flexible, rather than losing people because of a point in time. How can you work with women to create a platform or a framework that allows some diversity within approaches to work? Whether that's thinking about policies, thinking about practical things like uniform and where people work and what the temperature is in an environment, all of those things that can create, an environment where people feel comfortable to be at work. But also, I think doing that cost-benefit analysis of what is it worth to an organisation to keep good people at work versus losing them and then having to reinvent or re-energize their workforce, because the problem is going to keep happening if because women will experience perimenopause and menopause. So it's about finding those solutions now rather than waiting until it's so problematic that you have talent walk out the door.
Yeah, and I think it's a great point, particularly leading into uncertain economic times. Retaining great team members is so important because the cost to replace them is significant, as you mentioned earlier. So I'm really taking away from this that doing what you can to help your team members feel valued, supported, and health seems to be, from various reports I've seen, one of the big drivers that keeps people at a workplace.
Yeah, I think too, it's thinking about, businesses also have an opportunity to think about what's the benefits that they provide their employees. So, is it about looking at what insurances might they be providing that support people to be able to take leave when they need to? Do they actually provide enough income protection and those kind of things that may kick in if a person gets unwell through the process? I think that having really clear career planning, so that there's a strategy. Like if you're working with an individual and they are aware of the changes that might be happening for them, then being able to actually put a plan in place so that people can step out as they need to and step back in as they need to, so that way the work isn't interrupted, but nor is the person's career. So, but if you don't have a plan, then you miss all of those opportunities to be able to, I guess, create that workforce that is sustainable long term.
Mm-hmm.
And then I think, it's about also early in a piece, creating financial planning opportunities where people are then looking at their financial well-being and what part can a business play in terms of supporting their employees around that. So again, another benefit that keeps people at work and in the mix within that. So, and I think you asked me for individuals what the take home would be.
Yeah. On top of, we talked about the workplace, and then what businesses and what can individuals do, perhaps.
I think it's about prioritizing self-care. So, making sure that that open communication happens not only at work, but when you go home. It's about that education piece for everyone, your partner, your workplace, your family, in terms of this is a natural thing that I'm transitioning through, and this is some of the impact. This is how it might impact on us. So what's our strategy to work through that? So if you've got that open and honest communication, then basically that helps. But also then not putting everyone else first, which is something that we're really great at doing. So, making sure that that exercise routine is there. And, for women, having good strength-based exercise within your routine is essential, for good bone health, for good weight management, all of those things, great nutrition, because nutrition helps the mind, the body. And really focusing on stress management, because stress management then links to how you sleep. And it can reduce the severity of the impact of the symptoms of menopause. So that would be my take home. And kick alcohol, because it really is not your friend during menopause or perimenopause.
I remember being at uni and doing a biology degree and preserving things in 100% alcohol and learning that it's a metabolic poison. And then we go off to the pub and have a drink, and you think, there's a mismatch here.
Yeah. I think too is the last thing I'd probably add to that is, if you don't know, ask. Ask for help, because you don't have to suffer alone. And if you're not getting what you need, look, I was doing a consult recently, and someone kind of they thought they were going crazy, but they didn't go to a doctor, and they didn't, go and seek some medical assistance. And then when they did, they realized it was actually their menopause symptoms, and they were then able to get the support that they needed. But they had suffered for a really long time, changed career, done a whole range of things that were negatively impacting them. Whereas if you get advice early, then it's more helpful.
Yeah. So some takeaways I'm getting from this session are: the financial cost is huge to businesses and individuals. The non-financial cost is unknown, but likely to be much more than that. I heard you talking about starting the conversation and maybe helping people, organisations and individuals figuring out the language and how to have that conversation. So conversation skills are important. And then also being able to express needs and reach out for help. For organisations to make accommodations and allowances and provide support channels so that people know who to go to and how to seek help if they need it, as well as flexible working arrangements, among other things. And for women to be supported with really understanding what's going on, apart from reaching out for help, taking better care of themselves and making time for that.
Absolutely. And, on that, for younger people or women that are listening, start saving for your future, because bumps in the road happen. But if you don't have a fallback, then basically it makes those transitions much more difficult. So your bank account and your savings becomes, a really good investment because you have choice and options.
Such a great point to finish on. Thanks so much, Michelle, for your time today. Really appreciate it. And I know we're running a webinar, or you're running a webinar soon. We'll put the details of that in the notes for this episode, and we look forward to learning more about financial wellbeing in that session. And thanks for today.
Thanks, Mel.